Death always has a looming presence in the hallways of a hospital, and along with death is the aftermath of the spectrum of emotions nurses go through upon the demise of a patient. What are these spectrums of emotions? And most importantly, how do they get through it?
Good day. We are the Group 1B of 3F presenting our research study entitled Caring Through Grief, Exploring Coping Mechanisms Among Nursing Students Confronting Secondary Trauma from Patient Demise. I am Daniella Anna A. Beronia, and with me are
I am Nichole Bedrejo.
And I am Heizen Kale D. Blanca.
And I'm Erica Rose B. Cabatas.
Shall we begin? The purpose of the study was to explore different coping mechanisms adopted by nursing students with secondary trauma related to a patient's death.
For the methods, we adopted a descriptive phenomenological research design in order to delve deeper into the lived experiences of nursing students who confronted secondary trauma.
For the participants, a convenience purposive sampling was applied for the conduct of this research. The 10 participants were based from our inclusion criteria, such as number 1, the participant must be a bona fide student of the Bachelor's of Science in Nursing program, who is enrolled in the academic year 2023 to 2024. Second, the student nurse has experienced patient demise in special areas like the operating room, intensive care unit, delivery room, obstetric ward, medical surgical ward, or emergency room. Third, the student nurse has been experienced the symptoms of secondary trauma. Fourth, the participant should be from level 2, level 3, or level 4. And lastly, it is either male or female.
For our instrument, a semi-structured interview guide was designed to ensure comprehensive data collection, referred to as conversation with a purpose. Based on the availability of the prospects, interview was either face-to-face meeting or via Zoom. The open-ended nature of the inquiry clarifies the subject under examination while giving the interviewer and subject the chance to go deeper into particular subjects. It frequently contained questions to assist the interviewer respond. An overarching questions was provided to the participants in order to encapsulate their response in their explanation.
The initial segment of the interview guide focuses on capturing detailed socio-demographic information from the participants. The second segment delved into a thorough exploration of the lived experiences of participants who have encountered secondary trauma directly linked to a patient's passing, allowed for an in-depth understanding of the coping mechanisms student nurses employ during these emotional duress.
Now for our results. After the conclusion of our interviews, along with its transcription and interpretation using Kalaizi's method, here are our findings. First, the demographic profile of the participants. There is no evidence that suggests female nursing students were more prone to be exposed to secondary trauma than their male counterparts. However, it was revealed that females were more likely to report their secondary trauma symptoms or undergo increased levels of burnout and stress. Age also has no effect in secondary trauma experience.
5 major themes have emerged, namely number 1, the Resilient Symphony, the Art of Coping. Second, Echoes of Sadness, Secondary Trauma. Third, Pillars of Solace, Psychological Support. 4, In the Quiet of Nightingale, a nursing student's reflections on services, sacrifices. And lastly, Shifting Horizons, Spectrum of Professional Outlook.
Theme 1, Resilience is Symphony, the Art of Coping, focusing on the coping mechanisms adapted in response to the profound event of a patient's demise. Subtheme 1, Internal coping mechanisms are thought patterns that influence thought and emotional responses and are coping mechanisms done solitarily. This was evidently expressed by the participants in statements such as, sa me time ko ginaprocess ang gikalatabo kay daw ma-realize ko bala kag ma-self-reflection kong ginapanghimo. Subtheme 2. External coping mechanisms are one of the most common and frequently studied coping strategies. The research shows that the majority of the participants employed external coping mechanisms such as social and support seeking. 7 out of 10 employed both internal and external coping mechanisms. This was evidently expressed by the participants in statements such as, ginaistorya ko man sila ang mga CI, ginahambalan ko man sila na nasubuan ko, tas gina-comfort lang ko nila.
2. Echoes of Suffering, Secondary Trauma disclose explicit statements from the student nurses regarding their symptoms in the aftermath of their patient's demise. Subtheme 1, Identifying the Manifestations of Secondary Trauma, indicates the symptoms the participants have gone through, like saying, and I quote, "Kaagi na kami bangongot," unquote. This was evidently expressed by the participants in statements such as, and I quote, "Ginapilit ko magmuklat kay gabilin sa balagyapon sa mind ko how tapos gakabatian ko ang singgit," unquote. For sub-theme 2, cognizance of trauma, the participants affirmed that what they went through was secondary trauma after being read of its definition. This was evidently expressed by the participants in statements such as, and I quote, "At some point, yes, I could consider it nga daw ka secondary trauma," unquote.
For the theme 3, unwavering psychological support. It indicates that psychological well-being is crucial for nursing students, not only for their mental health but also for their successful adaptation to college or university life. In the sub-theme 1, satisfaction with continuous improvement feedback evaluation. This sub-theme exhibits the feedback evaluation of the student nurses after duty exposure to foster their professional growth, refine their skills, and ensure the delivery of quality patient care. One of the participants stated, "Oo, nakahelp gid ang feedbacking." For the sub-theme 2, under psychotherapeutic assistance, the research revealed that psychotherapeutic assistance maintains the well-being of the student nurses to provide compassionate care. This was evidently expressed by the participants in statements such as, "I speak for myself, gusto ko siya, gusto ko mag-go, gusto ko makabate," from tenured professionals.
For the theme 4, it is entitled In the Quiet of Nightingale, a nursing student's reflection on service sacrifices. It is the attitude of the nursing students after experiences of the patient's death and their responses towards nursing education. For the first subtheme, it focuses on the student nurse's attitudes following patient's demise, provides deeper insight into the emotional and cognitive shifts experienced by nursing students in response to the challenges of patient care and loss. One participant evidently expressed, "It affected me in a bad way. It made me anxious whenever I go duty ko." And on the second subtheme, the attitude of student nurses after experiencing patient's death related to nursing education shows how they perceive their educational preparation in the area of mental and emotional readiness for clinical practice. One participant evidently expressed, "After na, daw mas ginatry ko bala maging gentle sa pag-talk ko."
5, Shifting Horizons Spectrum of Professional Outlook, revealed explicit statements about student nurses of their exposure to their actualization in the aftermath of their patient's demise. Within the subtheme of Affirmative Professional Outlook, the student nurses shared that they experienced a boost in confidence and heightened sense of determination. One participant evidently expressed, "Do ka-develop ko bala ang sense of confidence nga mas ma-study ko before duty." Within the subtheme of Negative Professional Outlook, the student nurses express feeling a persistent lack of energy, an emotional exhaustion, and feeling of sadness. One participant evidently expressed, "It affects my confidence nga lower kay wala ko may mahimo."
For the conclusion, the results of this study displayed that student nurses who have encountered patient demise often undergo a profound emotional and professional journey. While some may emerge with heightened empathy, resilience, and a reaffirmed commitment to patient care, others may grapple with feelings of distrust and existential questioning. These diverse responses underscore the complex and deeply personal impact of patient demise on the evolving perspectives and experiences of student nurses within the healthcare profession.
For the recommendation, to the respected nursing workforce such as administrator, instructors, and counselors, implement robust support systems, including counseling and debriefing sessions, to help student nurses manage their emotions effectively. Integrate guided reflection and debriefing sessions into education to aid student nurses in processing and learning from challenging situations. Next, organize workshop focused on emotional wellness, resilience, and coping strategies tailored to the challenges of nursing practice, including encounters with death. And for the student nurses, future student nurses, and researchers, first prioritize self-care practices and seek peer support to manage the emotional impact of encountering death in the clinical settings. Next, acquaint themselves with the realities of nursing practice, including potential encounters with death, to make informed career decisions. Lastly, collaborate with the college administrators, clinical instructors, and student nurses to develop evidence-based approaches to enhance support and education in this area.
This has been the Group 1B presenting our nursing research. Thank you for listening.